What if the way you sleep tonight could tell a story about your health, say 10 years from now? It sounds a little futuristic, I know, but we're starting to realize that our bodies are constantly communicating these vital clues about our long-term well-being, and they're doing it all while we're asleep.
I mean, really think about that for a second. The idea that a single night of sleep could predict your risk for things like heart disease, dementia, or even cancer. It sounds like something straight out of science fiction, right? Well, according to a really groundbreaking new study from Stanford, this idea is a lot closer to reality than you might think.
Hello, I'm Dr. Sharif Mohammed. As a research specialist, I get to see a ton of new studies. But every so often, one comes along that just feels different. It feels like a real turning point. So today, I'm going to break down what makes this particular study so incredible and, more importantly, what it could mean for all of us.
We all think of sleep as just hitting the reset button, It's time for our bodies to rest, to recharge. But what if it's so much more than that? What if sleep is actually this active process where our body tells a hidden story about our health every single night?
Okay, so let's get into the specifics. Researchers at Stanford built a new AI model, and they're calling it Sleep FM. What it does is it takes all the standard data from just one night's sleep study, brain waves, breathing patterns, heart rate, movement, and it looks for these incredibly subtle signatures that a human eye could never ever catch. We're talking about tiny fluctuations in your heart rate or specific frequencies in your brain waves that you'd never notice.
So that leads to the crucial question, right? What can this AI actually find by analyzing all those hidden patterns? What is the story our sleep is actually telling?
The answer is, well, it's honestly astonishing. This model can predict the future risk for over 100 different health conditions. And no, that's not a typo, over 100. Just from one night of sleep.
So you have to wonder, is this like some kind of health crystal ball? What does it actually see? Let's get a little more specific here because the implications of this are just massive.
And listen, we are not talking about minor complaints. The AI was able to flag risks for some of the biggest threats to our long-term health, things like heart disease, stroke, kidney disease, dementia, and even certain types of cancer.
Now, here's something that is really, really important to understand. The AI isn't giving you a diagnosis. It's not saying you have this. Think of it more like an incredibly sensitive smoke detector. It's picking up on the absolute earliest possible warning signs from your body years before a fire would ever actually start. And this right here, this is where it gets truly revolutionary. Because a capability like this doesn't just improve our current approach to medicine. Nope. It has the potential to completely flip the script, to shift the entire focus of healthcare from just treatment to actual prediction. And this just lays it out perfectly. We're moving away from the old way, right? Waiting for symptoms to show up and then trying to treat a disease after the damage has already been done. And we're moving to an entirely new way, using these super early warnings to step in and potentially prevent the disease from ever taking hold in the first place.
I mean, from a public health perspective, this is a total game changer. Imagine being able to get this much more value out of sleep tests that are already being done in clinics and even at home. Suddenly, powerful early detection becomes way more accessible to way more people everywhere.
But let's be absolutely clear about one thing. This is an incredibly powerful new tool in the toolbox. It is not a replacement for the doctors and nurses who use those tools. The AI is here to support doctors, to give them insights they've literally never had before. And, this is critical, this model still needs a lot more testing. It needs to be validated on diverse groups of people all over the world to make sure it works for everyone before it can be used widely.
So, when you put all of this together, what does this new approach really mean for the future of our health? Where could this take us?
Well, it really points to a whole new trajectory for medicine, one that's built on three really powerful pillars. First, prediction, using tools like this to see what might be coming down the road. That enables the second pillar, prevention, allowing us to act early. And all of that leads to the third pillar, precision, a future of healthcare that's truly tailored to each and every one of us. So the next time you go to sleep, just remember, your body is telling a story about your past, your present, and maybe, just maybe, your future. And with tools like this, it feels like we are finally learning how to listen.